Thanks, Tom. Thanks very much. Let's get a little bit more information right now from Dr. Jonathan Reiner. He's a cardiologist with the George Washington University Medical Faculty Associates and directs the Cardiac Catheterization Laboratory at GW Hospital right here in the nation's capital. And with his longtime patient, the former Vice President Dick Cheney, has a new book that's coming out soon entitled Heart. Is that right?
That's right.
All right, let's talk a little bit about the former President Bush. He was always very active, jogging, all sorts of biking and everything. This comes as a major surprise for someone who's his age, don't you think?
Well, yes and no. Coronary artery disease has really been the most important disease in the United States every year, with the exception of 1 year, since 1900. It afflicts more Americans and kills more Americans than any other disease in the United States. So it's really not a surprise that...
But he had no family history, and his most recent checkups all showed, at least the annual physical when he was in the White House, he had low to very low coronary artery disease risk.
Yeah, again, we don't know exactly the exact parameters of all his risk factors. His level of fitness really only tells us, one piece of the puzzle. Other important issues like his cholesterol, his blood pressure, his glucose, these are other, indicators.
You brought an example of what he had to endure today, the stent put into his artery. Explain the procedure that he had to undergo.
Sure. So this is a coronary stent, a model of one, magnified about 10 times. And think of a stent as basically a metallic scaffold, which is crimped down onto a balloon, onto a very small balloon that can fit inside an artery that's just a few millimeters in diameter. And it's crimped onto a balloon, and when we maneuver a balloon into an area of blockage and expand the balloon, the stent scaffolding, the sort of metallic cage, expands and is embedded in the wall of the artery. And this serves to buttress the wall, keep it open, and relieve any blockage that was present before the procedure.
And you go in either through the arm or through the leg, is that right?
Right. Traditionally it's been done through the leg. More and more we do this through the arm.
Which is better?
Well, we do almost all our procedures from the arm. It's a procedure that's been done in Europe for many years. It's only now catching on in the United States. There's much less bleeding with it. Patients can get up right away. In our place, many patients go home the same day after coronary stenting.
Well, if he wouldn't have had this procedure, what would potentially could have happened?
Well, it's hard to know. We don't know the details of his anatomy. We don't know exactly what they found at angiography. In general, we treat patients either to prevent a heart attack from occurring, or to treat a heart attack, or to prevent symptoms. And, to be fair to the physicians caring for the president, we don't really have any kind of granular data to help us understand exactly why they did.
How long do those stents last in somebody's artery?
Well, hopefully forever.
You don't have to go and change them every 10 or 20 years or anything like that?
With a modern stent, and again, we don't know the specific type of stent that the president received, but for most patients, these stents will last forever, and very few of them will re-narrow.
Is pressure, stress a factor that could lead to heart disease? Because presidents, as you well know, and you've worked with the former vice president, they're always under enormous pressure.
Yeah, I think there's a difference between a job that has a lot of pressure and a job that has a lot of responsibility. And it's always amazing to me when I speak to folks who really have jobs that most people would think are highly pressurized, how much they enjoy their jobs. And, the flip side of that is folks who you would think have jobs without a lot of responsibility can really feel very pressurized, if they have a boss that's yelling at them or they really hate their job. So I'm not sure responsibility goes hand in hand with stress.
The former vice president, now he has major heart disease, as you well know better than anyone. How's he doing? First of all, I saw him on TV not that long ago. He seemed to be doing fine.
Oh, he's terrific. I think he was fishing today. I think he's really enjoying his life and really doing just very, very well.
Because at one point he was walking around literally with a machine to keep his heart going, and now he doesn't need that anymore. He had the heart transplant, and he's doing just fine.
That's right.
And this book that you've written with him, what's that about?
It's really the story of heart disease. It's basically the story of really the greatest success in American medicine as seen through a patient who has seen every single advance that medicine has created in the last 35 years. So it's really the story of heart disease as seen through one very extraordinary patient.
That would be Dick Cheney, and obviously he's had a much more serious heart issue than the former president, George W. Bush. Appreciate it very much, Dr. Reiner, for your coming in.
My pleasure.
Up next...